Sitting at this table is an 8-year-old boy called Scott. He is the only severe haemophiliac of his age in Britain who does not use factor VIII. His parents thought their unique treatment had saved his life. The professionals called it lack of parental care and willful neglect.
Lack of parental care and willful neglect. It's a terrible thing to say about anyone. But we weren't really prepared for the full weight of the thing.
Scott's parents want their story told. They feel that their experience will concern all parents, and that reporting restrictions in their case are being used not so much to protect Scott as to protect established professional practices. So we applied to the Secretary of State for Scotland to lift these restrictions. He refused because he considered it would not be in the best interests of the child. We've been obliged then to conceal anything which might identify Scott and to disguise the faces and voices of some participants. This is the most that you will see of Scott's family. Scott, of course, is not his real name. This is his story. Scott is the youngest of 4 children in a family with no known history of blood disorders. He was 6 months old when his condition was diagnosed. Scott was referred to the Haemophilia Centre at Edinburgh's Royal Infirmary, which treats all haemophiliacs in the region. The nature of Scott's illness was explained to his parents, and the treatment he would need. Haemophiliacs are born with a defect in the clotting mechanism of the blood. A factor, commonly known as factor VIII, is missing. Severe haemophiliacs like Scott suffer internal bleeding into joints, muscles and tissues which can be extremely painful. Untreated, repeated bleeds may lead to irreversible arthritis. Both these effects of a joint bleed can be prevented effectively by early therapy with factor VIII. The treatment is administered via injections of a concentrated form of the missing factor. The concentrate is derived from thousands of blood donations. Scott's treatment would be overseen by the centre's director, Dr Christopher Ludlam.
They put the onus really on you to come up for the treatment whenever they have a bleed. That's the idea. There is only one thing that they do. As far as we know, that was all that we were ever offered, was he would have to go for factor VIII if he had a bleed. They told us how we would know if he was having a bleed. And that was what we were supposed to do. But we felt that we would wait and see.
Scott's parents began to evolve their own treatment using homeopathic advice and remedies. Scott suffered bleeds, but none of them, his parents felt, warranted treatment with factor VIII concentrate.
We're not saying that every haemophiliac in Britain should try it, are we?
Oh, no. I mean, I think...
We feel...
We're not waving any flags saying haemophiliacs should not take factor VIII. It's a very personal thing. I think you need to have nerves of steel for a start if you want to start this, and be prepared to wait and see what happens. And I would hate to think that anybody said, right, we'll just go and try that. They say that works. We don't know. We, in all humility, we think that it has helped his condition.
Their reluctance to use factor VIII concentrate was increased by what they learned about its possible side effects, including liver damage, viral infection including hepatitis A and B, and changes to the body's natural immune system. And then they heard about haemophiliacs in the United States contracting a new and apparently deadly virus.
This would be when he was 2. Two and a half.
82, 83.
Between 82 and 83. and the AIDS business was cropping up. And there was programmes on about the strange thing that was happening in America, and the haemophiliacs were affected by it. And of course, you only need to hear the word haemophilia and your ears prick up, you know. And we wondered, we thought, no, we don't like the sound of that. And so when we went up to the clinic, we asked, we said, what about this AIDS business? And they said, oh, I don't think there's really anything there to worry about. And
well, in fact, I said to the doctor, I says, what guarantee can you give me that he won't catch AIDS?
From factor 8,
AIDS,
if he gets it.
If he gets it. And he says, 1,000,000 to 1. And my answer to that was, what happens if he's the one?
The Haemophilia Centre's confidence was based on the fact that Scotland in 1983 was largely self-sufficient in blood products. The threat posed by the AIDS virus seemed a distant one. But Scott's parents were not reassured. They continued with their own treatment for Scott's bleeds. Unless it was a life or death situation, they insisted, Scott could cope. Then in late 1984, just after his 3rd birthday, Scott injured his right knee.
So we were forced really to go to the Haemophilia Centre with him. And they wanted to give him factor 8. They said he's had a knee bleed. And we said, well, we feel that the risks are too high. We don't want this for him. He's managed up till now. But they said he must have treatment for this. He just must have it. And they said we could give him cryoprecipitate, which is a blood product involving, I think, 7 or 8 named donors rather than the thousands involved in factor 8. So we agreed reluctantly to this.
Scott was treated with cryoprecipitate. The same month, his parents' worst fears were confirmed. In December 1984, it was reported that 15 haemophiliacs in Scotland had been infected with the AIDS virus. At the same time, it was revealed that haemophiliacs throughout Britain had been similarly infected after being injected with contaminated factor 8 concentrate. Today, 1,200 haemophiliacs in Britain have been diagnosed HIV positive. Scott's parents are convinced that their refusal to allow their son to have factor 8 may have saved his life.
We just feel we've been very lucky that that was the case. You know, we feel that we did this. Others maybe wouldn't have. Maybe when they've watched, if they had watched a child having a bleed, they would say, oh, I can't, I daren't. But we didn't feel like that. We felt that we would rather have given him his chance than go and take a chance on factor 8.
Parents of haemophiliac children who have been infected are now leading the campaign for proper compensation. But even those who have contracted the AIDS virus continue to rely on factor 8 as the only effective treatment.
Oh, it was great because our sons alleviated their suffering. I mean, when I took a bleed, it stopped it quickly. So therefore they were relieved of pain much more. They thought it was great because they could lead practically a normal life.
And presumably they're still using it?
They're still using it. Uh-huh.
Donald Baird has 2 haemophiliac sons. Both now have the AIDS virus. As a parent of haemophiliac boys, his response to Scott's case is typical.
I think what surprised me was the fact that the young laddie's done so well without factor 8. You know, I can only relate to my 2 boys and how much they've had and what it's meant to them. But obviously they've got something right so far, this couple.
We feel that if we can strengthen him so that he can deal with this condition himself, then that is the best thing we can do for him. We don't want him to be someone who's dependent on a hospital and a centre to keep him normal, in inverted commas. We feel that if he can learn to cope with this condition with the help from natural medicines, then that's the best legacy, if you like, that we can give him.
But how did Dr Ludlam view Scott's treatment? As it happened, he didn't view it again for 3.5 years. Normally, haemophiliacs are in continuous contact with their centres and receive at least 2 reviews a year. Scott's parents didn't hear from their centre again until June 1988. Scott was now 6½. Scott was taken to the Haemophilia Centre by his father. He was limping because he'd injured his right knee again, a recurrent injury.
And we brought him in, and he had a look at him, and examined him, and they said he had a look at his knee. And I explained that he had about 3 bad bleeds into that. Oh, he didn't, he still wanted the x-ray. So in a sense that was the end of the interview with him, because he still was insisting on factor 8. And I was saying I didn't see any reason for factor 8 after I gave my explanations, and I left.
Dr Ludlam was adamant that factor 8 concentrate was an immediate and necessary treatment for Scott. Scott's parents reiterated their own criteria for use of factor 8.
If it was life or death, we wouldn't hesitate. And even if we felt, especially if we felt that his health was deteriorating, he wasn't coping, he was bleeding regular, then we would consider factor 8 then. But that didn't seem to be good enough for Dr Ludlam.
Dr Ludlam has declined to give an interview on this case or on any aspect of his work. In a letter, he explained his approach to treating haemophilia.
In my view, an available treatment becomes mandatory if without it a child suffers substantially.
So how can a mandatory treatment be given to a child whose parents are opposed to that treatment? Dr Ludlam tried during a number of meetings and through letters to persuade Scott's parents of his point of view. By the end of 1988, he decided to resort to law.
Going to law is something that we really do not like to do. I mean, it's not an ideal situation at all. And so the doctor has to decide whether balance the differences between the threat to the illness or long-term future of the child to the wishes of the parents. And it really is just a clinical dilemma. Individual doctor will deal with it in a particular way, another doctor might deal with it in a different way.
Dr Ludlam chose to contact the children's reporter, whose job is to assess whether a child is in need of compulsory measures of care. If so, the case is referred to a children's hearing, which will recommend appropriate action. In extreme circumstances, this can extend to separating a child from his or her parents. When Dr Ludlam described Scott's case, the children's reporter identified 2 grounds for referral to a children's hearing under the Social Work Scotland Act: lack of parental care and willful neglect. Scott's parents were summoned to a preliminary hearing where they totally rejected the grounds for referral.
Our attitude is they have no right to do this. But as we look into it, when it all started, everybody says, oh, but they can't do that. But they can. That's the thing, they can. And that's what's so alarming, is that people like us can find ourselves in this situation where we're charged under an act when very obviously he is a well-loved and cherished child. It's so scary. It is. It's scary and destructive.
Because Scott's parents rejected the grounds for referral, Scott's case was automatically transferred to the Sheriff Court. The Sheriff would decide whether or not there had been lack of parental care and willful neglect. In preparing for the court appearance, Scott's parents sought advice from Dr Pat Hannaford, a GP who also practices homeopathic medicine. She agreed to present evidence on their behalf in court and to help the family in their care of Scott.
The only evidence of ill effects from his haemophilia is the damage to his right knee, which is swollen, it is stiff. However, he is functionally very good. He runs on it, jumps about on it, rides a bicycle, has no pain in it. And in terms of his actual functioning, he's a very impressive little boy. He's robust, he's stoical, he's confident, and I think that's very important when considering that he's suffering from such a serious chronic disorder. in spite of knowing himself that he's vulnerable, it hasn't made him fearful, overprotected, anxious, as one can imagine might often happen with children in a similar situation. And I feel that this strength that he has comes from his family background and from the way that the family functions.
Dr. Hannaford's support was encouraging, but Scott's parents were still not confident that the sheriff would reject the grounds for referral. However well they put their case, they felt that the law was likely to uphold conventional medicine.
Well, I don't think any doctor can assume the backing of the legal profession. I mean, the purpose of taking it to law, it's almost like taking it to a sort of arbitration. The doctor will put his or her clinical judgment on the line and will tell, in this case, a children's panel, in Scotland it would be a children's panel, that he or she believes that this is the right treatment. No doubt the patient's relatives will put their particular point of view. And then the law, which is the public process, has to make a decision in the interests of the child. You are right that in the past the general tendency has been to support clinical judgment, but you can never assume that.
At the end of February 1989, both parties went to court. 2 weeks later, the sheriff issued his ruling. The grounds for referral are upheld. The sheriff rules that Scott is in need of care. He considers that the parents have acted unreasonably, and as a matter of law, they have willfully neglected their child in a manner likely to cause unnecessary suffering and injury to health. At the end of April, the Children's Hearing impose a compulsory care order. Although Scott will continue to live at home with his family, he is now under the supervision of the local authority, and his progress will be monitored by a social worker.
The beauty of the child care system is that although the ground of referral was established, it doesn't automatically mean that the child is taken away from its parents and so forth. That it is a situation where the Children's Hearing can, and social work agencies can try and work out a satisfactory position, or as satisfactory position as possible between the child and his family. And as I understand the current situation here is the child's still at home with his parents, is happy, but if persuasion of the parents to come round to accepting conventional treatment fails, there's always a fallback position of overriding the parental refusal, because the child is technically, I think, in care of the local authority. And at the end of the day, as I said in a paper I wrote about this case, while it seemed a gross intrusion of parental autonomy, or might appear to be that, at the end of the day, we might have actually reached a sensible result, or as sensible a result as possible, because if the child had a very bad fall now, there would be no difficulty at all that the conventional treatment could go ahead.
So in theory, Dr. Ludlam can now legally administer factor VIII concentrate to Scott, against his parents' wishes. Not everybody views this outcome with satisfaction.
I think this case raises a great many problems in terms of choice, of civil liberties, of the rights of the individual as opposed to the weight of particular current conventional thinking.
There's a gut reaction that a tremendous injustice has been done, because for a start, the charges neglect or willful neglect are very serious. And what isn't at issue here, in my opinion, is that neglect has taken place. The judiciary or doctors have decided that the neglect has taken place, but the parents have always exercised their rights to be parents in the best interests of the child. And there is a fundamental problem here, because the power of the parents, when exercised against the power of society, the parents lose.
It's traumatic. It fills me with rage when I think about it. I have a seething resentment which is there permanently. because I don't think we deserve to be under a supervision order.
But despite the power of the supervision order, mandatory treatment with factor VIII concentrate has not so far been imposed. So what will happen if, when, Scott suffers another significant bleed? Will the Haemophilia Centre overrule the parents' wishes? If so, how? Or have Scott's parents altered their view of the situation?
I'm not convinced. I don't care what they do. They can heat it, stew it, boil it, do whatever they like to it. AIDS hasn't gone away. I mean, they won't guarantee that you won't catch it. What if somebody doesn't heat it properly? What if a batch slips through? While there's the chance, I certainly wouldn't be interested, not unless it was an emergency.
But Donald Baird's experience suggests that the long-term management of Scott's haemophilia could still involve treatment with factor VIII.
I think in the evidence of my two sons, yes, it would. Because they do suffer more when they get a bit older. Apparently when the bones start to grow and joints stretch or whatever. We have seen it with both the boys. So it may get more difficult for them.
Now, the boy's mother there said that it didn't matter what they did with factor VIII, she still didn't fancy it. What would you say to her?
Well, once again, that's a hypothetical question for me because, you know, I've never been in that position. I would say, obviously, if it was going to deteriorate the boy's life, he must get it. But at the same time, she's got a point. She's got a point. It's very confusing, actually. You know, the fact that my boys have got the AIDS virus and she's doing her damnedest to stop her boy from getting it. I wouldn't like to be in her position, to be quite honest with you.
The medical profession think you're wrong. Now the legal profession think you're wrong. What do you think?
I think I'm right. He's our son. We have got him to this stage without factor VIII. We have brought him up to the best of our ability. We feel that we very possibly have saved his life. I don't care what the medical profession thinks. They've been wrong this time. As for the legal profession, God preserve us from the experts.
Next month, the Children's Hearing reviews the supervision order. It might be lifted. It may be extended. It could be strengthened. Whatever happens, the decision will be justified as being in the best interests of the child. But according to whom? Whose child is it?
It's the parent's child. There's no doubt about that. And because we've been concentrating on a grey area and a difficult area, there is a tendency to get the whole thing out of perspective. I think that's a very, very important point. The law is there to underpin the family. We give parents rights, we allow them to choose their child's religion, we allow them to choose the child's schooling, and so forth. And we underpin the family. But the family position can be abused.
The trend would be that it's society's child, not the parent's child, because society will step in, and that is the legal system, in whatever form. Society will step in if a problem is perceived.
Well, the question of ownership of a child, as you are well aware, is a very difficult question. And obviously one hopes as a parent myself that I own my own child. But I think that child is also entitled to protection from society in certain instances, particularly if their health or even their life is at risk.
He's our child, and I deeply resent anyone trying to take responsibility for him. He's our child, ours to look after, ours to save his life. If it comes down to it, we were charged with lack of parental care and willful neglect. In actual fact, the wrong people were in the dock. It's because we care so much and because he's so precious to us. He is our child and nobody cares for him like us. So there is no one else as interested or will take as much care as we do.